Hi, everyone. Welcome back to Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida, here to talk with you about various topics related to mental health, COVID-19, and how we're going to all get through this journey together. Today, I'm very excited to introduce my guest. I'm always excited to introduce my guests, but especially excited today as we are actually introducing our new CEO for the Mental Health Association of Central Florida. So with that being said, I'm going to introduce Dr. Marni Stahlman. Marni, how are you today?
I am really excited to be here with you, Faith, and for the folks that are watching via digital and virtual, and to be back at the Mental Health Association of Central Florida. We'll share in a few minutes why I say back, but it's really exciting, and I'm thrilled to be a part of the organization again.
And we are so excited to have you. For those of you watching with Coping Together, Marni has already been a great addition to our team. I foresee a lot of really great things with having her here. And I think that, one of the reasons that I wanted to bring you on as a guest to the show, Marni, that I think makes you, again, a really great CEO is you have a background in mental health that I think is relatively, unique and for your position. So would you be willing to share a little bit about that background?
Sure. So I actually am a psychologist, and my doctorate is in counseling and psychology, working specifically with children. And for a very long time, I did direct care services in residential treatment centers and hospitals. I did a short stint as a CEO of a psychiatric hospital back in the 90s, and that's when I came into contact for the very first time with the Mental Health Association here in Central Florida, and joined the board. And from 1993 to 1994 was actually chair of the board of directors for the association. So that's why I say I'm thrilled to be back. So I have worked in the healthcare and specifically behavioral care field, both as a direct provider and also as an administrator of sorts for more than 30 years.
Wow, that is a wonderful thing to share. Thank you so much. Thank you for your dedication to mental health. I say that as a student in mental health, and I think it's really wonderful when I get to meet and interact with people who've been doing it for a while and to see the different areas that you've kind of contributed to. You haven't just done the clinical aspect, you've done very different things, and I really think that that's wonderful. So thank you for sharing that.
Thank you. I'm happy to.
Perfect. So that's actually a really great segue into, your new position with the Mental Health Association of Central Florida. And I want to ask you, what is the one thing that you're most excited about in serving as the new CEO of the agency?
Well, aside from being able to work with yourself and other really dedicated team members here that have really been so mission driven, I think the single thing that I'm the most excited about is the intersection of how timely it is to have an organization like the Mental Health Association of Florida that in 2021 will be celebrating its 75th anniversary here in Central Florida. The intersection of what we do and how expertly we have been able to do it for so long. At the time that we find ourselves now in the COVID-19 pandemic crisis, where the intersection of mental health and wellness is so essential when we talk about all of the different effects and impact that COVID-19 has already demonstrated and has yet to demonstrate for what will come, even as we see now a rise in the virus spread across the country. When we are able to hopefully in the not too distant future see a subsison of that, we are all going to be faced with the stress and anxiety residue that has developed, and how we go back to finding that center or well of resilience that is so essential to coping and managing all of the change that has happened just here in our community alone, with the effects that it has had on us economically and the industries that have been practically devastated by the effects. What does that mean as we redefine who we are as a community? and as people that work in that community, and as people that support that community. And that is difficult, and sometimes rising to find that level of resilience, as I said, can be hard, because we're suffering and dealing with such a tremendous amount of change. So I think, long way to answer your short question, that I'm the most excited to be here at this time and to be participating and being able to lead the organization and what we have to offer, so that our community can start to heal.
I think that that's wonderful, everything that you shared. And I kind of want to add to that and say, as someone working in this field and working at this agency, one thing that I'm very excited about to have you as the new CEO for is, whether it was intended or not, I feel like when COVID happened, mental health has entered this new era of change and prominence, hopefully, in the world and in the country. And I think that it's wonderful to have you kind of serving as this leader for the Mental Health Association as we experience this new journey. Because, like you said, this reality with COVID, and I say it a lot here, it's not going anywhere. And even when we do have a vaccine, or we have, we've reached a significantly lower amount of cases, there is still going to be that residue of that stress, of that anxiety, of that depression. And I think that kind of leads me into my next question for you, which is, how do you mentioned a little bit about the perception of mental health in the public and in the government, but how do you think that mental health in general and its perception will be impacted by COVID? What do you foresee in that area?
Well, when I think about the word COVID, the first word that comes to my mind is loss. The loss, obviously, of people, of family, of people that we care about, loss of industry, loss of being able to interact in a physicality that we no longer are able to do, the loss of closeness, the loss of being able to have the freedoms that we sometimes took for granted, about just being able to go to the supermarket or grab a beer with a friend or dinner or walk around Lake Eola. Those are, so at the juncture that we're finding ourselves, and as to your point, for the better part of probably the last 75 to 100 years, the discussion and topics around individuals who are managing a mental health diagnosis, which I like to call a behavioral medical condition, right? Because the stigma around saying mental illness still is pervasive. But when you quantify it back to, this is a behavioral care medical condition, it starts to be seen in the same way, in some respects, of how we manage other chronic medical conditions, diabetes, high blood pressure, Crohn's disease, different things that we know are now manageable, but don't necessarily have the same stigma when we admit that we are grappling with that as a daily occurrence in our lives. And I think one of the things that I have seen change happily since my work in the 90s was that, from a generational standpoint, individuals like yourself are more willing and able to talk about, in a more free, less stigmatizing way, than maybe somebody from my generation or even older, because we have old stereotypes about how that might affect competency or intelligence or your ability to do performance in some way. And we know so certainly that if managed and treated, none of those things happen to the degree that they are supposed to believe to be. And so that's the eradication of that stigma. And I think your generation, and even the generation of my 12-year-old daughter, we can learn a lot from, about when they go to their center of looking for resilience, it's matched also with a identity that helps them see that they are a good self-advocate. And by being that self-advocate, they are able to navigate for themselves in a way that previous generations were not as comfortable, because they weren't given that kind of permission to be that kind of vocal. So that part I'm excited for. I think that for where we are and for what's to come, as I said, the grief and loss, that we traditionally only think of in terms of, stages of death and dying. In some ways, we are seeing the death, the loss of ways of life, not just of people. And how do we readjust to that? And how do we make new normal?
You make a really great point on a lot of that. And one thing I wanted to touch on in regards to kind of the generational standpoint, I do really agree with you that there has been a kind of wonderful shift in the view and the way that we approach mental health or behavioral medical conditions, in the way that we can talk about it. Because I know for myself, there's a sense of relief, I think, in my generation when it comes to the vulnerability that we feel comfortable talking about. Obviously, not everybody does, but I think that in general, there's a more accepted notion of it in my generation. I am one of many friends of my own who struggle with anxiety, or I live with anxiety and I cope with it. And that's part of, why I am such an advocate for mental health, because I think that it can affect you whether you're a child, an adult. I mean, it knows no age group. And I just kind of moving forward, I think that with COVID-19 and these things that we've been impacted by, and with the shift in our generation, I agree with you that we can learn a lot either from my generation or, like you said, your 12-year-old daughter's generation. So thank you.
Yeah, and the stigma and the stereotyping has really undergone a very needed and wonderful transformation, I think. And hopefully that will serve as a good foundation for, as we grapple with this second wave of COVID, how we recognize and how we treat each other to support.
Yeah, absolutely. And so that actually kind of allows me to shift into our next portion of this discussion today, which, we talked about the grief and the loss that a lot of people are experiencing, and you're absolutely right. And I think, I'm sorry if you hear that, my dog is crying. I don't know why. But in regards to COVID-19, I think we also, we see an increase in stress, an increase in anxiety. And one of the things, and I think that this ties back to your point about, older generations not being as willing to accept or be willing to consider behavioral medical conditions, is the concept of an anxiety or a panic attack. And so I wanted to ask you kind of, one, what can cause a person to have a panic or anxiety attack, and how does the pandemic play into that?
So great questions. And I think that on any given day, as a human being, we have generalized anxiety disorders that are just bubbling low below the surface. It's how we've been taught back again about how to be a self-advocate and how to rely back onto that well of resilience that I think will determine whether someone is able to manage it in a moderate way that is or has very little daily effect on how they function, versus that it can become a completely debilitating and really significant behavioral care condition that can inhibit and limit an individual without, if they don't seek care and treatment and understand how to look for signs and symptoms. So let's go through a few of those, right? So generally, most people are going to be able to self diagnose that they are experiencing anxiety in some form or fashion. Some very traditional and common: sweating, Oh gosh, I feel nauseous. I'm walking into this appointment. I have anxiety. You can kind of, that phrase, I feel it in the pit of my stomach when I'm getting ready to take a test or going for my mammogram, whatever. You kind of have those kinds of body aware signs and symptoms. And that's really, we function as human beings in this kind of fight or flight kind of state of existence. And so it's really the flight elements that get exasperated when someone is experiencing a panic attack or an anxiety attack that has maybe not gotten to that full blown effect. So again, as it elevates, it could actually manifest in some very significant physical symptoms that include abdominal cramps, dizziness where you might faint, chest pain, headache. Many people sometimes have been reported to go to the emergency department thinking that they're having a heart attack, and what they're really having is an anxiety or panic attack, because the symptomology and the physicality of what's being manifest medically in our bodies is very, very similar. And I don't think that that's an accident. I think that that is our body's way of protecting ourselves so that we understand, hey, this is something that you really should be paying attention to and not ignoring, because it could get worse. So what could start off as, some slight hyperventilation, some moderate sweating, some nausea, I feel dizzy, can really elevate up to and include being hospitalized and having to be treated medically in order to get that control back of our body. And then, of course, what goes along with that are some of what we call ideations. As our bodies begin to react medically from a thought and thinking standpoint, so does our brain as a living organ, and so does it impact how we may view the situation that we're in, where either it could result in someone feeling that they're being threatened in some way, or that they feel such a loss of control for the surroundings that they feel at risk and unable to get back control, so that they can self-calm. Oftentimes, from being the youngest little child with a parent, your mom or dad, when you see a young child crying, they're reacting to something where they feel like they don't have control. And so moms and dads will say things like, use your words, take a breath, calm down, or take a picture in your mind of something else that makes you feel comfortable or comforted. But these are all things that are done on a daily basis that happen sometimes without us even thinking about it, as we calm ourselves from a phone call or a Zoom to something that could elevate to be much worse. I think the difference in where it comes in is how the person is able to recover or not recover and manage from a self-care standpoint to the point where they may need assistance and somebody else to intervene on their behalf, or for some cases, medication to help them absolutely calm down.
I think that when you consider that as well, it almost, with a panic attack and anxiety attack, I really do again love your terminology of the behavioral care condition, because it does kind of go back to the body, like you said. It seems like it's our body's way of talking to us, of telling us something, and so that really leads me into my final question for you, which is, why is it beneficial for those of us who've never had a panic attack or an anxiety attack to be familiar with these signs and symptoms? I'm sure there are plenty of us who are like, that's never happened to me. That's never gonna happen to me. So why is it beneficial for all of us to know it?
Well, I think the truth of the matter is that at some point or another, we have all had an anxiety or panic attack. It's just how it's manifested and to the degree that it has inhibited or debilitated ourselves from functioning, right? So I'm a horrible test taker. And my panic attack occurs not while I'm taking the test, but 30 minutes beforehand, when I have revved up in my mind already that there's no possible way that all the information that I'm soon to be tested on, I'm going to be able to access or remember. So it's almost a self-predicating, deliberate, self-sabotaging occurrence that happens. And so from a self-care standpoint, some things that we can do for ourselves to kind of waylay that immediate fight or flight till it gets to that extreme point is to be aware of what are things that we can do for self-care. At a very basic level, it could be something as simple as a daily affirmation, something that resonates with us, that confirms that we can be in control, that we have a capability to do the task or be a part of what we are being asked to participate in. And also to be aware of what might be triggers that would potentially exasperate or get worse. So if you know that a trigger for you when you're in a stressful situation has to do with that nausea feeling, right? What can you do to practice maybe taking some breathing, or even removing yourself from the physical environment that's making you nauseous and get a break? So I think it comes back to what can we do from some self-care initially to help us waylay some of those initial medical reactions that don't exasperate to the point where we feel like we're choking or gasping for air, or that shortness of breath, or that we've completely become incapacitated with trembling and shaking and nausea, and it takes maybe an hour or so to recover. Know your triggers, and everyone has some. It could be memories that are especially emotional and impactful that might cause that to reoccur. It could be environment. I get not an anxiety attack, but I certainly get a sense um, of, of heightened stress when I smell garlic.
That's so
So
interesting.
yeah, it's very interesting. And it has to do with the fact that when I was pregnant with my daughter, garlic was a smell that I got deeply sick from and developed an aversion to, which is unfortunate as an Italian, because that's always inherent in food we eat. But I got very sick to the point where I would vomit if I smelled it while I was pregnant. My daughter's almost 13 years old. It's been a long time since I've been pregnant, but if I walk into a restaurant and they're cooking in an open kitchen and I smell garlic, I start to physically manifest that same sort of reaction that I had, where it takes me back to when I was really sick. So smells can trigger, environments can trigger, people can trigger. Know what yours are so that you can develop, before that experience happens, safeguards for yourself to get you out of them or have them be decreased, and employ them.
Just to add one final kind of question, hearing you say that we all have triggers, how do you feel like the media and COVID-19 plays a role in that? Do you think that that's a trigger for a lot of people, or it might be?
I think that for the last several years, because technology is so pervasive and the immediacy of technology and information is so in our face and present all the time, that we are bombarded from a sensory standpoint in a way that we have never been before. And I think it absolutely, not just media, but I'm saying technology and information in general has created a heightened sense of activity and awareness, and also the desire to have what I call immediacy. At your fingertips is any kind of information you could possibly dream of knowing. Not to date myself, but back in the day, Being in high school and college, we actually had to go to the library, and we actually had to pull out resources and books. We had to know what the Dewey Decimal System was in order to find it on the stacks. I think if I said Dewey Decimal to my 12-year-old today, she would not know what that is.
I'm proud to say I know it, but I'll be honest, I haven't touched it since probably fourth grade.
Exactly. So it's just not a thing we need now. But the anxiety of, why can't I get that information? The anxiety of every time your phone dings that someone has texted you or that an email has come in, and you feel like you must respond immediately. If I don't, what will they think of me? It doesn't give us any time to plan. It doesn't provide us any opportunity to think and digest. What do I want to say? It's taken away the thoughtfulness that we all used to, I think, have and be able to count on. So back to your question, I think that something like this is an anxiety-provoking agent just by the nature of it existing. If it's not next to us or on our person or within an arm's length, where's my phone? Why can't I get my phone?
There's actually even been literature, like research literature, that shows that if someone loses their phone, it's like the equivalent of feeling like they've obviously lost their purse, lost their wallet, but like they've lost like a loved one, like close to them. Like it's that panic of you can't find your mom in the grocery store, you can't find your cell phone. Because it is so tied to who we are. And I think you make a really great point that, and do you think that that could possibly be why we're starting to see a trend in anxiety in younger kids, especially?
I do. I definitely do. And I also think that this facilitates isolation because you don't need to actually be with someone to feel like you're connected to them. And there's nothing like seeing someone face to face and interacting with them that in this environment doesn't happen. And I think definitely in my daughter's generation, because that's all they've known, they think having a chat is a play date. And it's not.
You just broke me a little bit. Wow, that's, oh my goodness. Like a FaceTime is a play date?
Yeah.
Wow. That is a generational shift. I mean, that is an era shift. I don't even have a response to that, but I hear you. And I hear this, it kind of, it really sounds unfortunate and like contradictory that we're having to find this balance in the era of COVID of being safe and social distancing and quarantining when we need to, but also not wanting to promote this isolation and, you know, reliance on our cell phones. And I think obviously we can even admit that as adults, we also have somewhat of a reliance on our technology. I think that that's just kind of how the world has been generated to be at this point. But if, you know, tell me if I'm thinking along the same lines or you're thinking along the same lines of me, like it kind of seems like we're in this balancing act. Especially I think parents are.
It's very contradictory because, as you said, to remain safe, we have to rely on the technology to keep us connected and to be able to function. But it also is something that we need to be mindful of, that we, even if you only have one other person that you're living with and that's who you're quarantined with, or a few people in your family, when there are times during the day, shut this off, put it away, and make a face-to-face connection even with the person that you have to stay quarantined or isolated with. Because just as human beings, we weren't meant to be alone. And we weren't meant to be disconnected. And back to the topic, another really wonderful intervention for having and dealing with an anxiety disorder is to make sure that you have someone that understands what you're experiencing and can be a safe place for you to go and connect with, and to have them be aware that you are having those triggers occur, and be someone that may be able to be intervening on your behalf to calm you back down when that disorder or attack has occurred to such a degree that you're not capable of coming back on your own.
That is such a great point. And so unfortunately, we've run out of our time. I really do feel like I could talk to you about this for a long time. So I'm sure this won't be the last time I talk to you about this kind of stuff. But thank you so much for being here, Marni. We are so excited that you are our new CEO. For all of you at Coping Together, I know that I can't wait to share with you, and you can see how we continue to grow as an agency, how we continue to get to reach people. I mean, that is what we love to do here. But really, thank you all to you for watching, because you're the reason that I get to do this show. And so with that being said, if you have any topics you'd like to see, please reach out to us at the Mental Health Association. We'll, as always, include our information in the comments below. But with that, I will see you all next time.
Faith, let me point out and just say one last thing.
Please.
If somebody is watching today or knows of someone that is trying to manage stress and anxiety that is beyond just a mild or daily occurrence that doesn't happen very frequently, it's okay to get help. And it's okay to call us, because we can connect you as an organization to any number of community resources and individuals that can help create an opportunity for you to live a better way each day and manage what's happening.
That was a wonderful point to close on. Thank you so much, Marni. And thank you all, and we will see you soon.
All right. Bye-bye.
Thank you.